Live from the Carl Chevrolet Studios in West Des Moines, this is Iowa Live.
Welcome back to the program, everybody. Did you realize that May is National Asthma and Allergy Awareness Month? And with that in mind, it is time to check in with Dr. Ravi Johar. He is the Chief Medical Officer of UnitedHealthcare of Iowa to talk about seasonal allergies with asthma complications and tips to how to manage respiratory health and things like that. You're going to be a busy guy over the next 5 minutes, Dr. Ravi. How are you doing today, sir?
I'm doing fantastic, Lou. It's so good to be with you.
Yeah, this is great. Now, why can this time of year be so rough for people? And it's for a lot of people.
You know, it doesn't even sound like we should say seasonal allergies anymore because people seem to have them all the time. But certainly during the spring and summer, they tend to be a lot worse. And that's because of some of the allergens that are out there. We know that early in the spring, a lot of people have problems with tree allergies. And then as the season progresses, as we get into the summer, it becomes grass allergies. And then later towards as fall is beginning, it becomes ragweed allergies. So there's different pollens, different allergies out there during the time, and they can cause a lot of reactions.
Yeah, and
people are getting out.
Yeah, what's going on with the body? You said it's causing a lot of reactions. So what's going on with the body here?
Well, they release pollens and different irritants. As those get released into the air, those blow into your eyes, nose. They cause a lot of problems with itchy, runny noses and eyes that are tired, irritated, red all the time, itching, and even problems with breathing. And it really increases, especially if you've got something like asthma or any other kind of underlying lung disease. It really exacerbates those and can become pretty severe at times.
Wow. Now, do you have any kind of a checklist for a high pollen day or something? Because that's what we're experiencing now. The pollen counts seem to be amazing.
Yep, there's a lot of great trackers out there, and it's a really good idea to keep an idea of what's going on out there. But the best way to avoid problems with allergies is to avoid exposure to them. So tempting as it sounds, you want to keep the windows closed in the house so the pollens don't come in. You want to make sure you have the air conditioner running and maybe even put a big HEPA filter on your HVAC system to really kind of help control some of those things. If you are outside, we know that the middle of the afternoon is the worst time to be outside for allergies. So you want to get out there in the mornings or maybe in the early evenings. If you are outside during the day, wear a mask or eye protection to help with those allergens from getting into your system. And then once you come back into the house, things you can do are change clothes right away. Don't walk around inside the house with everything on. Take a shower if you need to. And above all, just kind of make sure that if you're on any medication and you have problems with allergies, start addressing them early. Be ready as the allergy season comes up, and make sure you're on the medications and things you need to ahead of time.
Yeah, now people that have asthma, seasonal allergies can really trigger some complications. What kind of stuff are we talking about?
Well, you start to see a lot more problems with wheezing and coughing, difficulty breathing, even shortness of breath. And often they're not relieved with the rescue inhalers that people are on or their normal asthma routine. And if that starts to happen, that's when you really need to seek medical attention. If you start having problems breathing, if you start to have increasing problems with tightness in your chest, things of that sort. And when your normal routines aren't working, over-the-counter medications aren't doing the trick for you anymore, or you're taking them more than it's indicated on the box, that's when you really should go seek some medical attention.
Okay, yeah, let's talk about time to seek medical attention here. We have a list here of things you need to look for. You just mentioned your symptoms not being controlled by the medicine that you're taking right now. Do people really experience blue or graying of the lips or face? Is that common?
It's not common, but when it does occur, it can be very, very serious. That's a sign that your body isn't getting the oxygen that it needs. It's not getting everything into the lungs that it needs to, and not being able to transfer all that oxygen into the bloodstream. So when that happens, that's almost an emergency. You need to really get in and get that taken care of as soon as possible.
Yeah, no, well, what should people with asthma do to stay out of the ER? What's one of the things that they can do?
Again, the thing we know that exacerbates asthma is the allergies. So anything you can do to avoid exposure to those allergies is really important. So like I said, staying inside whenever you can, not getting outside during the worst times, keeping a very good eye on the pollen count, like you mentioned. Be careful during that time frame, and making sure that you're taking your medication as prescribed for you and staying pretty pretty compatible with that.
So if none of those things are working, that is the right time for you to seek medical help. That is so important. Now, if people want to get more information about this, where can they learn more?
Well, certainly, talking to your physician is a great place to start. And then going to uhc.com will give you a lot of information that you can utilize about allergy or any other areas that you may have some problems with.
Dr. Ravi Johar, you're awesome. Thank you so much for your time. We appreciate it. We'll see you next time.
Thanks, Lou. Take care.